Hello, everyone. This is Dr. Van Merkel with Science-Based Nutrition, bringing you another bit of information. And this one is going to be on warning signs and observations. And doctors, we really need to pay attention and closely observe what's going on with their patients. And hopefully by doing that, we'll be able to help them understand little things that they may have going on that is their body's way of telling them that there's something happening, something that needs addressed. And for you people out there, maybe this will help give you a clue on things that you can observe on yourself that maybe will be an early indicator of potential problems you may be developing or headed toward. So let's go right into it. Warning signs and symptoms. Warning signs and observations. People who are frequently sick. If you're getting sick all the time, catching everything that's coming around, something else is going on. You've got a lowered immune system, and you need to find out why it's low. It could be something simple. It could be low in vitamin D, might be anemic. Who knows? But you got to test to find out. If you bruise easy, if you're not on any drugs and you bruise easy, there's a problem. You heal slowly. I know when we're younger, we heal quickly, but are we healing well? Chronic skin problems, rashes, eczema, things like that, boils, stuff like that. It's a sign of an internal problem. Yes, if you have even psoriasis, there is an internal problem that needs corrected. It's not that you lack drugs. You don't need drugs to clear up your psoriasis. You need to get to the bottom of the problem and fix that. And yes, psoriasis, eczema, we've seen go into complete remission. Fingernails and toenails. And one of the things I always do when I'm doing a consult with my patients, especially a new patient, is I always look at their fingernails. And maybe I'll take a look at the fingernails. Maybe it's a female who doesn't have, fake nails or painted nails. And I'll look at her nail beds and say, wow, look how pale your nail beds are and purple. And I'll show them mine, how mine are nice and pink. And the patient will say, well, what is that, doc? I'll say, I don't know, but that's bad. That your nail beds are pale and purple, not a good circulation problem, anemia, etc., things like that. Maybe their nails are cracking. What is that, doc? It's bad. One of the things I also do when I look at fingers is look at their joints. Now, the skin over the joint should be the same as the rest of your hands, but if it's red, the redness at the end of the fingertips, I'll commonly ask them, does your mother or grandmother have crooked fingers? Osteoarthritis. Well, that redness on the end of your joints is the first sign of it. That is early osteoarthritis. Now, right now, that's completely avoidable. Completely avoidable if you get those crooked fingers. And any of the redness now you have now is reversible. That is early degenerative joint disease. Now, when we talk about that, the patient will go and say, well, joints, are those essential or non-essential? Well, they're non-essential. Here's why I tell people, maybe that's just the tip of the iceberg. And you have more serious problems developing, and that's just the tip of the iceberg. There may be things that we can't even see yet. But what is there in joints that's necessary for your body to heal and repair and actually detoxify toxic chemicals? Sulfur. So maybe in the body's incredible wisdom, the body's willing to break down the joints because it needs that sulfur somewhere else more important. So think osteoarthritis, rheumatoid arthritis. The body's breaking down the joints, actively breaking down the joints, maybe because it needs those nutrients somewhere else more important. It's willing to sacrifice the joints to keep you alive. Rheumatoid arthritis, it is possible to put that into remission. And in some cases, even reverse the joint damage if it's not too bad. But look at those fingernails and see if there's redness, early sign of degenerative joint disease. Edema in the ankles. Now, I'm a chiropractor. Whenever I would adjust people, I pull up on my high-low table, it puts the patient down. I pull up the foot piece to put their legs a little more relaxed state. And one of the things I would do is while they're laying face down, reach even through their jeans and push on the tibia and see if I could rub my fingers over the jeans, see if there's edema there. And so a 19-year-old boy, I pushed on it. I think, wow, there's edema here. I put him on his back, slid pants like down, was still pitted. I said, that's +4 pitting edema. He said, what is it, doc? I said, I don't know, but that is bad. There's about 20 things it could be that's causing edema. Are you going to guess on a 19-year-old kid? Where from heart disease, kidney problems, liver disease, all kinds of things. You better not guess. You better find out what's going on. And also look at the color. Are the ankles darker than the rest of the leg? Are the feet darker? That's a sign of poor circulation. It's a sign of health problems developing that can be hopefully reversed if you catch it soon enough. Check the pulses, tremors. Or they have shakes, Parkinson's. I've done, and I'm going to be doing some more information, webinars, blogging on Parkinson's and tremors. So stay tuned for that. Decreasing memory concentration. That's going to be along with the Parkinson's. When I talk about Alzheimer's, I'm going to tie it in with Parkinson's, so hang on with that. I want to talk about depression. How many of you are depressed? How many of you have patients that are depressed? Well, we all have patients that are depressed. And a lot of times I'll be doing a consult, and this patient, maybe she's got chronic fatigue, fibromyalgia, she's on cholesterol meds, diabetes meds, blood pressure meds, and depression meds, just a whole host of problems from insomnia, chronic fatigue, upset stomach, indigestion, headaches, hot flashes, etc., etc. You know what I mean. Now look at them and say, do you have any reason why you're depressed? I mean, really, do you have a reason why you're depressed? Did your house burn down? Did your dog die? Did you lose your job? Do you have a reason why you're depressed? Look at me and I'd look like, well, I don't know. Then I'll ask them, well, if you felt really good, had great energy, were sleeping well, didn't have hot flashes, had good digestion, would you still be depressed? Well, I don't know. Well, maybe you're depressed because you feel like crap. You've seen so many doctors, you've taken so many drugs, and nothing has helped, and you have no hope. You think you're going to feel like crap the rest of your life. You know what? I'd be depressed too. It's true. Wouldn't it be depressing thinking you're going to feel like crap the rest of your life and no one can help? So here's what I tell patients. The brain can be no healthier than the body. If your body's not healthy, if you're getting indigestion, you got hot flashes, you got chronic fatigue and fibromyalgia, you think this is going to work right? I tell my patients the brain is the most sensitive organ to nutritional deficiencies, imbalances, and toxicities. You get your body healthy, this will improve too. And it will. And I'm talking, I've helped people with all kinds of psychological problems, bipolar, manic depression, major anger issues, OCD, all kinds of things. And it's not because I'm a highly empathetic listener. Because you know what? I don't want to hear your crap. Everybody's got crap in their life, don't they? But I know if you get healthier, this is going to improve too. And if this improves, you're going to be able to do everything else a lot better. So depression, maybe it's just the fact they don't see any way out. Get your body healthy. It's amazing how this improves too. Frequent changes of in the eyes, floaters, vision problems, things like that. Had a lady come in, she was about 19. And the first time she came in, she was with her mother. 2 months later, she comes in by herself. And she's just so excited. She's feeling better. Her periods are now normal. The bleeding, cramping is much, much better. And they've been on time. Her digestion, her skin problems, her acne is all better. She'd feel better just with that, huh? So she feels great. And digestion's improved, sleeping better, etc. But then she says, could you have done anything to help my eyes? Well, I looked through her file to see if she had mentioned anything about her eyes. She didn't mention anything. And I said, well, you didn't mention anything about eyes. What do you mean? And she said, I've had floaters in my eyes that have been developing over the last 2-3 years. And it had gotten to the point that I could no longer drive. She'd seen 3 eye experts, ophthalmologists. They all said they never go away. They just get worse. And she said, unfortunately, you can't drive now. As quickly as they're progressing, you'll probably be legally blind within a couple of years. And she said, after being on your program just 2 months, they're completely gone. The floaters are completely gone. And I said, well, of course we can help your eyes. The eye is the most delicate part of the body, the most sensitive to nutrition deficiencies, imbalances, and toxicities. You get your body healthy. You think your eyes are independent from the rest of your body? No, your eyes can improve too. Floaters, pretty easy to fix. Cataracts, we've actually seen improve where their optometrist doesn't even mention them anymore. Glaucoma, that's a pressure problem. Get your blood pressure control, other health problems. Glaucoma can improve too. Macular degeneration cannot improve it. We can sometimes stabilize it, but there's other factors with macular degeneration. And so she was thrilled that we helped her eyes in just a few weeks. Now I want to talk about my mom for a minute here. My mom's 88. About 3 years ago, she went to an eye doctor, and the eye doctor told her, "You're going to go blind in 6 months if you don't get cataract surgery." Well, you tell that to an 80-year-old lady, and she's going to be panicked. She calls me all upset, all worried, thinking, Vanna, they said I'm going to go blind. I said, doggone it. Can you read your Bible? Well, yeah. Do you have any problem reading the paper? No. Any problem watching TV? Well, no. Any problem driving? No. Scumbag doctor just wants to do cataract surgery. I told her she's going to go blind if she doesn't get it done. Really makes me upset. So I told my mom, look, go to another eye doctor. But this time, don't tell them what the other doctor said. And if they say you need surgery, ask them these questions. Can you guarantee I'll see as well as I do now after cataract surgery? Or whatever eye surgery you want to do, will I see at least as good as I do now? And can you guarantee that that surgery won't cause macular degeneration and lead to blindness? So she goes to the doctor, and the doctor said, you need cataract surgery. You have age-related macular degeneration. And then they said, you need surgery. And then my mom asked those questions. The doctor said, oh, don't even ask me those questions. Don't even ask me. Because there's no guarantees. So she calls me back and said the doctor didn't want to talk about those complications, side effects. Well, then, Mom, if you can you still read your Bible okay? Newspaper, drive, do everything you want? Well, yeah. Medicare pays for these surgeries. And so they think everybody needs them. But you don't need it. In fact, my mom has told me about a friend of hers who had cataract surgery, basic cataract surgery, could see as good as Mom. And after bilateral cataract surgery, was totally blind within 3 to 4 months. And that's been several years now. She said, her friend had said the doctor has apologized many times, but it's too late. She's blind. Yeah, cataract surgery. There's been some studies show cataract surgery causes or accelerates macular degeneration that can be reversed. So I said, Mom, but she said, well, I've got age-related macular degeneration. Now, I don't mean to be mean to my mom, but I said, Mom, look at your feet, look at your hands, look at your face. Mom, you got an age-related body. You're not going to have the eyes of a 20-year-old. But she said, well, I can't see at night when I drive. What are you doing driving around at night? But in all reality, night vision is something that declines as we age. And I said, Mom, as long as you can read, watch TV, take care of yourself, do everything you want, why mess with it? And she can. And she has the most perfect, beautiful, artistic handwriting. I don't know if you've seen somebody from years ago. They used to really work on practice on her penmanship, and hers is beautiful penmanship. And so I think, now, if she can write such tiny, beautiful handwriting, she's obviously got to be able to see very good. And she does. And so hopefully that helps. Vision problems, we don't recommend doing surgery. Digestive aids, Prilosec is a horrible drug, and similar drugs because it reduces hydrochloric acid. You reduce hydrochloric acid, stomach acid, and you have now started on a cascade of poor health. You're not going to be absorbing proteins. It's also going to affect your gallbladder and your body's ability to absorb fat, soluble vitamins, etc. Constipation, diarrhea, stools that float. These are all warning signs. Gas or bloating, bad sign, bad breath, coated tongue. Had a cute little couple in her 70s come in, and I was doing a consultation with a guy. Now, this couple didn't have any health problem they knew of. They just came in to get checked out. So we have a lot of people, I talk about longevity a lot, and they come in just to see how they're doing. And that's how they were. And I was doing my consultation with him. Now, when I do a consultation, as I said before, I push on their tibia for edema, look at their nails, see how their nails are. And I also want to look at their tongue. And so when I had the guy stick out his tongue, his wife said, wait a minute. Whenever we chew gum, the same gum, and he spits it out, it's white. When I spit out, it's gray. That's weird. So I had the guy stick out his tongue. Okay, it was fine. Then his wife stuck out. Then I said, okay, I had his wife stick out her tongue. She stuck out her tongue. I go, ooh, I'm holding up the mirror. I say, ooh, put that thing away. You looked at that thing lately. Your tongue is nasty. She said, well, what is that, doc? I said, I don't know, but that's bad. There's about 20 things it could be. There are truly 20 things it could be. Are you going to guess? Or should we test and find out what's going on? Many things can cause that, even some things like lack of hydrochloric acid, but it could also be something like hemochromatosis and other conditions. So the tongue only tells you there is a problem, not what the problem is. You cannot diagnose just from looking at the tongue. Guaranteed. Blood out of any orifice it's not supposed to be out of is a bad sign, long-term drug use. Drugs do not extend life. All that drugs do is delay a premature death. And if you are on any drugs, you will not have an optimal lifespan. The only way to get an optimal lifespan and optimal health is to be healthy, so you don't need drugs. Again, drugs don't extend life. All they do is delay a premature death. Skin, hair, and eyes. Had a cute couple in their late 20s come in, and the husband had all kinds of chronic fatigue, fibromyalgia, major headaches, skin rashes, joint problems, indigestion, nausea. He'd get hot flashes at night, just a mess. And after I did his consultation, I looked at his wife. Now, his wife is a cute little thing. And she worked at a high-end beauty salon in Dayton, Ohio. You know how they're all cute and made up with makeup and her hair is done, everything else. And I looked at her and I said, you don't look good. You look like you don't feel good. Because when I looked at her, I could see her eyes weren't nice and white. She had bags under her eyes and her skin just didn't look healthy. And I acknowledged what she knew. You know, she said, thank God somebody finally told the truth. I feel terrible. But everybody blows her off because she's cute, trim, thin, and she's got makeup on. And so because I acknowledged what she already knew, I did a consultation on her. And when we tested them both, we did some advanced testing on them. But the thing that was most identifying on them was we did a hair test and found that they were 3 times off the chart in arsenic. Wow. They were both 3 times off the chart in arsenic. Now, where were they getting the arsenic? Kind of find out the house they bought 5 years before was built near an old landfill. They were being exposed to arsenic from that. Now, the point of that story is the symptoms were different on these 2 patients, but the cause was the same. Symptoms were different, cause was the same. If you were doing functional testing, if you were doing muscle testing, energy testing, would you have found that? Probably not. So these are warning signs. Look at their posture. How are they standing? So these warning signs, doctors, you must not dismiss or minimize these. Patients, people out there, be aware of these warning signs. They'll lead to nutritional consult and testing, and you're going to save a life sometime by finding things where they're not obvious, but they're smoldering. And hopefully they'll create awareness about the present state of health to your patients. They'll doubt in the patient's mind about their true state of health. They'll offer potential, identify potential critical situation, and hopefully a desire to find out what is really happening. And doctors are going to help to establish you as the expert, caring, thorough, and knowledgeable. Because you see, other doctors that they see are trying to kick them out of the office as soon as they can. I had a patient come in and tell me when they went in the doctor's office, they got a slip. And the nurse said, you can write down 2 items you want to discuss with the doctor. You have 5 minutes. If you want to talk about more than 2 things, you have to schedule another appointment. So unfortunately, that's the way some practitioners have to practice because they work for a large medical facility. You got to crank out the numbers. You be the better doctor. You identify what you see. Let the patient know that maybe you have a solution for it. But these signs and symptoms are basically warning lights that your body is giving you that there are problems. We'd be happy to help you if you have problems like this. At sciencebasednutrition.com, contact our office. We'd be happy to put you in contact with a doctor, maybe in your area that does this type of work. I've been doing this laboratory type of work for over 30 years, and we've seen just about everything. And we can probably help you because virtually any condition, there's ways and things you can do to be a little healthier than you are now. See, I'm Dr. Merkel. Hope this has been helpful to you. Leave us some information or comments if you like. Have a great day. I'm Dr. Merkel.